Mahiben Maruthappu, the Innovation Advisor of the National Healthcare Services in England. You just had a talk about e-health and what are the trends for the upcoming years, the 5 to 10 years. What are the three trends you're seeing?
Yeah, so I think we're going to see three major trends that are going to transform medicine over the next 5 to 10 years. The first is genomics and personalized medicine, whereby now the cost of genome sequencing has come way down. Therapeutics are becoming much more targeted, and so we're seeing a movement from one size fits all to one size fits one. The second trend is data and digital. We've seen the tremendous impact digital has on all parts of our lives, and now is the time for healthcare to really embrace this opportunity, this revolution in technology, to use digital, allowing patients to be at the center of their own treatment and to manage their own conditions, but also to slice through administrative costs. And the third trend is hardware and wearables. So smartwatches, wearable devices, all of these allow us to provide better interconnected care and also to capture far more useful information about an individual's health. And when this is combined with the disruptive force of 3D printing, we're going to see people printing the devices that they need when and where they need them on demand.
Today we're talking about e-health at the e-health convention. Which of the three trends is most important to, if we talk e-health?
So when it comes to e-health, I think it's going to be the digital. Digital is perhaps, of the three that I mentioned, arguably the most disruptive and the one that we can act on most readily. The majority of people in the Netherlands, in the UK, in Europe have their own phone, and a lot of them have smartphones. This represents a real opportunity for us to use a very powerful device to improve the health of entire populations of people that at the moment we're not making the most of.
Is the NHS ready for e-health and for all these digital smartphone applications?
I think we have to be. I think given the overwhelming impact digital is having in so many other parts of society, there is real pressure now to use digital and to build a health service or system that can harness technology and can make it available to all of its patients and consumers.
What do we have to do? We have to create awareness for the professional, for the patient. What's the most important thing we have to embrace?
I think we need to be very careful about information and making sure that patients get to control who has access to their data and information through digital. We need to move fast and enable innovators to implement and deploy their technologies in the system as opposed to potentially blocking them from doing that. And that will really open up the system to far more innovation and turn it into an ecosystem for digital. And that's where we need to be going.
Which stakeholder is the most important if you look at e-health or transforming the system in England, but also in the Netherlands, do you think?
I think it's going to be patients, and then after that it's going to be frontline staff like nurses, clinicians and managers, as those are the groups of individuals who are going to actually make this happen, who are going to be able to deliver digital and allow us to unlock that opportunity at a system level.
What's the NHS doing in order to let them embrace all these opportunities?
So we have a number of initiatives that are supporting frontline staff in being more entrepreneurial and building innovations, such as our Clinician Entrepreneurs Program, which is giving people protected time to build innovations. And we have our Innovation Accelerator, which spreads the innovations that have been tried and tested by clinicians and other staff across the NHS. We also have a number of programs that increase the awareness and digital literacy of patients and different members of the population in England.
Last question, what's your advice for the Dutch healthcare system and the stakeholders?
I think keep doing what you're doing. There's a real amount of fantastic energy here. I think interoperability and empowering innovators are going to be two really important pieces of this puzzle to get right in the coming years so that the digital revolution can be really harnessed.
Thank you.
Thank you.